Hello, and welcome to the Holistic Nurse Academy podcast, where we blend philosophy and theories in Eastern and Western medicine. And today we're doing something a little different because usually we hear why people go from traditional Western medicine to Eastern, more, ideas. But today, Wendy, my friend who's a nurse, is going to tell us a little different story, which I love. And when we were at lunch the other day, we got into this conversation, and I was like, this is exactly the kind of conversation I want to have on the podcast because you're a nurse. So Wendy's got a background in nursing. We'll talk about that in a minute. But also because a lot of what we talk about is meeting people where they're at. And part of meeting people where they're at is kind of knowing their background and knowing what shaped their beliefs and their approaches to their health. So, hi, Wendy, my friend.
Hi, Holly. So good to be here.
Glad we got to get here together. Wendy and I have been friends for a long time, so this is going to be fun. She washed her hair for you guys today.
I did after 3 days of bleh.
I got a text saying, I guess I better wash my hair. So, lovely as always. um, So, Wendy, my friend, you have an awesome background in nursing, but you are much more than a nurse. And what has shaped you and brought you to where you're at? We actually have some things in common in terms of some things we experienced through life, which one of those things brought us together and is how we met. We're both authors. We both wrote biographies and stories after losing our moms to suicide. And that is part of our story and part of our healing. So, Wendy, where do you want to start in your journey? I want to get to this conversation about from Eastern to Western, or I guess holistic modalities, alternative modalities. It's not really Eastern necessarily, but how you got, your background and how you were raised and how it shaped some of the ways you changed the way you looked at nursing and also health, your own health, your family's health.
Well, I'll start at the very beginning, actually. We'll
Per-
start at the very beginning.
Perfect. We want
Anyway,
new sound of music.
you don't want me to sing.
Yeah.
Um, so one of my earliest memories, my very earliest memory is falling out of a truck when I was not quite 2. So that would have been more than 6 decades ago, and, um, and being rushed to my grandfather's home, um, where they picked out all of the pebbles and rocks and, um, you know, uh, didn't think to take me to a doctor. We didn't do that. I mean, I think back then, um, it it was all copay, or it wasn't copay. It's not like, "Oh, I've got insurance, I'm gonna go see the
Yeah.
doctor." It was, you just took care and bandaged up the knees, and my hands had pebbles in them. Don't know if I hit my head. It could explain a lot if I did. But I fell out of a truck on a freeway or highway,
Funny. Oh, geez.
and, I remember, that this was my earliest memory. From there, as far as, um how I was raised, my mother became before my sister, who's the third in our family. I'm the oldest, and then she's 4.5 years younger than I am, almost 5 years younger than I am. And before she was born, my mom and all of her sisters, now, mind you, there were 9 siblings. She was the youngest of 9 in her family, and the oldest was a chiropractor. And back then it meant he went to um, Wyoming, Thermopolis. There's lots of um, hot tubs there, like mineral springs. And so when she was 15, there's a letter that she wrote to my dad that said, you asked me to get a checkup. So I went to see my brother, and I have heart problems and I have back problems and all of these things. So she immediately started treating her heart problems and back problems. Now, I think he just kind of looked at her energy. She soaked in some hot tubs, and that was kind of him, lots of herbs, lots of things. So there was a full embrace of this kind of lifestyle by the time Dr. Christopher came into vogue. Now, he was lecturing around um, our community. He came from our community. And I was hauled as a very young child to these lectures, along with my siblings who also remember this. And it was about developing your own herbs and concoctions and all of this. And she did. She became quite a knowledgeable herbalist. And I remember being deathly ill on a camp out I was
Mm.
with my aunt. I might have been 6, 7, 8, somewhere around then, maybe younger. I don't really have a good understanding of how old I was, but in that grade school, um, early years. And I got really sick with diarrhea and vomiting. And out comes the enema. And I'm there, my parents aren't
Oh,
there.
no.
Mortified. They have a trailer, but the little porta potty is outside, a little thing you squat on, and they did put up a little curtain, but I had my cousins there. One of them was, an older male cousin, and then two of my very dearest cousins who were older than I was. And here I was, this little girl, 6 years old, about, and getting an enema from my aunt. Nothing more traumatic. And that was how every cold, every vomiting, everything was treated. Enemas with tea, lots of cayenne pepper, lots of onion poultices around your neck, maybe a little mustard there, garlic poultices on your feet. So I, and then um, my mother became very ill. She wanted to juice, and we always went to spas, and she juiced, and she did all of these things to treat her heart condition. She had this great heart tonic. It was mostly brandy that she kept downstairs, and she'd take a swig every now and then for her heart condition that was, mind you, never diagnosed by an actual doctor. And medicine was a little different back then. You still had house calls. She delivered my brother at home, but it was too scary. She had RH negative. He was RH positive. And back then, this doctor, who was one that she would go to, who would deliver at home, um, was injecting her with my dad's blood because my dad was RH positive. Now, how dangerous is that? I'm guessing some of that still happens by
Yeah.
the naturopaths and stuff.
Yeah.
But my nursing mind is like, holy cow. And she lived. But so she was injecting him with all this, or injecting herself with my dad's blood to prevent any issues with the baby. Well, he was born early, and he was very, very small, and is scared the living daylights out of her. So the next baby, the last one, the fifth one, she had in the hospital, but it was a 12-hour stay, and she came right home. But that was a little safer. She, a couple, during that time, right after she had this baby, within 6 or 8 months, she was taking tons of licorice root. She also had severe postpartum depression, but she was taking tons of licorice root for her undiagnosed heart condition.
Mm.
And licorice root um, can cause bad arrhythmias. It decreases your potassium to very dangerous levels. It leaches your potassium if you're not having the kind that takes out the glycyrrhizinide. It's deglycyrrhizinated, or however you say that word. DGL licorice is a safer form of licorice. Well, and I learned all of this later as I was prescribed
Sure.
licorice root
Yeah.
by a holistic MD
Mhm.
for some condition. I don't even remember. And I started having palpitations, and I then looked it up. What's causing this? And sure enough, the licorice root can deplete very quickly your
Mm,
potassium. Well, she ended up having a cardiac arrest. Her
right.
heart stopped. She had a near-death experience. 6 months later, she took her life. So that I didn't put all that together until really in the last 10 years, but 15 maybe. But she was so committed to this religion of not seeing doctors because her mother died of a stroke in a hospital before the doctor got there. And she was terrified of doctors and Western medicine that she led us down this path as a whole family. Some are still on that exclusive path or near exclusive path and very afraid. So I come by a fear of doctors naturally,
Yeah.
of medicine in particular, naturally. Um, and yet I'm a nurse. My
Yeah.
son's a doctor.
Yeah. I
But
know,
there's
isn't that crazy? Yeah.
generational fear of doctors. And I look back over time in our genealogy, and there are many healers, nurses, doctors in the genealogy, as well as cousins. We're pretty smart people that way, and also have a desire to heal and to treat and to care for others who are suffering. So as a new mom, I've been without my mom now for 7 years before I get married. And when my kids have conjunctivitis all the time, I did have a doctor who was more on the alternative side, shall we say, an MD, but he would prescribe ginger for nausea or whatever, and nothing really drastic like licorice root that at mega amounts,
Mhm.
or um, comfrey that can cause liver failure. Um, and I really liked him. He was great. And he delivered uh, three of my babies. Well, he missed one, but he came in at the end. Three of my four babies. And he, so I would take him there, and I trusted him. Um, take the kiddos there. But I never got to go to a doctor for horrible tonsillitis. My tonsils are permanently scarred. My sister had scarlet fever. She had the rash. She went into kidney troubles, etc. Um, but you could cure anything with a fast of apple juice and grape juice and all this olive oil that just sort of congeals and makes these stones that everybody says are gallstones. But if you dissect them, they're olive oil mixed with apple juice.
Yeah.
When you actually study them, they're not gallstones. Gallstones can't come out your little bile duct. So you can tell I have a healthy skepticism of some of this stuff.
Yeah, yeah.
But anyway, so I didn't, I tried to treat these illnesses. We did have insurance by then, but you still had to pay a copay, and we were very poor, sometimes not even a quarter to our name. And so I put garlic poultices on our feet. Now, that's not going to pull out the bacteria from your tonsils. It's just not. There's no way, no how that will work. It might open your lungs to put an onion compress on there, and you might feel a little bit better. But it's not going to necessarily take care of the strep. And so my poor kids suffered with my experimentation. I gave lobelia, I gave catnip and fennel, I did all sorts of stuff to treat the maladies of my young kids. My daughter, still to this day, she she really is troubled that the morning of trek. So she's 12. It's her first trek to Martin's Cove. She's got a horrible earache and she can't hear out of this ear. And I'm like, oh, let's just put a little silver drops in there. You'll be fine. I didn't have anything to look in her ear. And thank heavens, thank heavens, they had a doctor on trek who did look in her ear, and it was impacted with wax. And he was able to clean it out, get it out, not with the little wiki things, that
Yeah.
can also be dangerous, but with an actual tool
Yeah.
and help her so that she didn't suffer the rest of trek. But that silver that I had put drops in had actually expanded that wax and made it even worse. And so those are some of the horrifying experiences. Now I went back to nursing school when my husband was diagnosed with MS, and this was 38 years ago, that he was diagnosed, a little more than that. And there weren't any treatments for MS. And there hadn't, the biologicals had not been yet developed, and they did have steroids, and so he had his fair share of steroids over time. Um, but they told us that he would be in a nursing home within 10 years, and to stay away from heat. And that was the extent of the treatment that they had to offer. And so, of course, we were desperate. We thought it was terminal and that he would die. We learned along the way that no, it's just disabling. And he has had a progressive course. But we're grateful for the medications, including the chemotherapy that he had 20 years ago that put him in remission for 10 years and he regained function. But at the time, we were desperate for any cure, and all the cures came out of the woodwork, everybody with every multi-level marketing scheme. And we joined them all. And he tried KM and all sorts of tonics, and they all made him worse. And sure, they might boost your immune system, but with MS, that's precisely what you don't want.
Mm-hmm.
And he would become much more sick.
Mm.
And thank heavens, about 8 years into the course of his illness, they came out with the first biologic. I think it was Avonex or one of the other earlier ones, Beta-Sera. Insurance would not pay for it, so he never got to try Beta-Seron. But once insurance, and these are expensive medications, they cost a lot to research and develop, and they're biologic, so they have to grow it, the
Mm.
cells. They have to grow the cells in cell medium and stuff, and it's a hard process. They don't know precisely how some of them work, but they do know precisely, or they have a really good idea how others work. And there have been a lot of developments over time in this area of MS, which I'm the most familiar with, some cancer, but MS because we've lived with it. And so he tried them, many of them. He was on Avonex for several months until he became allergic to it. And just couldn't tolerate it. And then he was on the next one and the next one and the next one. And he had many allergies to many medications and often felt like a guinea pig. But he is still walking much of the time today. And we know because of how much brain atrophy and disease he has in his brain and spinal column, up and down his spinal column, C, cervical spine, T spine, that without those treatments, he would be in a nursing home in 10 years, is the outlook that there was for a male with MS at the time. And even now, they're able to look at the data because there are enough people who still choose the natural way versus, and do all the dieting and all that, which is good. It's not
Yeah.
bad. It's
No.
good, but they opt not to do medications. And so now they have large population studies, and some of these have been done in Canada, where they can look at the comparison data. And the people who do early intervention with medication with a true MS diagnosis fare better on the disability scale and over the long run.
Mm.
There is still no cure. It is still a disabling disease that will eventually progress.
Right.
for most people.
Right.
Some have like a benign form, but those medications were life changing for 10 years for my husband.
Right.
And it was chemotherapy. And we had to pray and we had to fast and we had to say, are you sure we want to do this? Because the risk of heart valve damage was real and the risk of another cancer was real. But he was in progressive MS, secondary progressive MS, and his brain had atrophied substantially. At the time, about 5 years before this time, the doctor had told him he had the brain of an 85-year-old.
Mm.
He was, and that same doctor is the one who said, Mark, you have black holes in your brain, and people wait too long to start this medication, which is used for leukemia. Um, and but if you wait until you're wheelchair bound, you will not get out of a wheelchair. And so we're so grateful that he did that. And yet I had siblings really criticizing that choice that we made through fasting and prayer and contemplation and research and trusting a doctor, a neurologist who had a lot more experience with MS than we did. And how grateful we are that we did that. By then, I had chosen to go back into nursing, and I was going to find the cure for MS. And of course, we haven't, and there isn't. But there are ways to make MS patients' lives better. And yes, can diet help? Can exercise help? Yes, all of those things are important. But there is not an herb that will help. There is, in fact, most of them will cause increased illness if they stimulate the nervous system or stimulate um, the yeah,
Immune
your
system.
immune system.
I got
Yeah,
you.
but we're so grateful for that. So I became a nurse, and I, loved my microbiology class. I actually did do a research paper on MS and looked at the different causes at the time, and this is many years ago, more than 30, that 38 years ago, that I researched and did a huge research paper on MS and the immune system and the genetics and all of that they knew at the time. And they have learned an awful lot more since. But I was going to cure MS. I was going to go on, get a PhD, et cetera, et cetera. But working in with the newborn babies, I loved that. I didn't want to do adult care. I tried being my husband's nurse with some of his IV therapies. It terrified me. I did not want to be there when if he's allergic to IVIG at home.
Mhm.
And so I was the director of a home health agency at the time, Intermountain Home Health branch. And he did have a home health nurse, but hey, I'm a nurse. I'll do his care. I don't do that anymore. I advocate strongly for his care and for any of my family's care. Well, had my own brain injury. The third in 2 years ended my nursing career. And at the time, I, of course, sought out the traditional care of PT, OT, speech. I had to do speech and cognitive therapy and all of those therapies, neurology, because I have and still have to this day severe limiting trigeminal neuralgia that is constant every single day. And when they call it the suicide headache, there's a reason for that. It is intense. And thank heavens, it waxes and wanes in intensity. It is always there. I'm always tingly, always have pain, but sometimes it's 8, 9. I never say 10 because I would think I'd be dead if it's 10.
Yeah.
But but when you're crying and yeah, pulling your hair to try to distract from that level of pain, it's pretty intense. So I I sought out all of that kind of care and also because all along the way, I've seen chiropractors. I've, looked up the studies on different, on garlic. Is that all I need? I don't need to go to the doctor, and I can do garlic or oregano oil for this, which have antibiotic properties.
Right.
It's not standardized, and you can really do harm to your gut, but there are good properties from herbs. In fact, my daughter was going to go into a PhD program to study the medicinal properties of different plants. And there are some
Yeah.
that she was actually in a research program at the time, taking out toxins, neurotoxins from cone snails that was helping with pain. And they were doing studies on that up at the University of Utah. And it's amazing and it's remarkable. Most of our medications actually come from plants.
Right.
But the nice thing about medications is that they are studied, A, B, they take out some of those compounds that are harmful, like your whatever. I can't remember what the aspirin is. You probably do, but um, you can go to Good Earth and get something that'll help the pain, which is the same substance that's in aspirin, but it's not buffered.
Right.
And it's not, those parts of the plant are not taken out that make it a little bit safer. And not to say that medications are always safe. They're not. There are side effects to both, whether it's herbs or medication, whether it's acupuncture. There are side effects that people need to be aware of. And so even before this brain injury, I saw a chiropractor consistently. I had had different injuries, and my physicians actually referred me to a chiropractor who I still see to this day very occasionally. Um, I have two. I have a Nuka chiropractor that seems to help with the trigeminal pain, and I have a body, the rest of my body chiropractor who helps if I have lower back pain. But I don't go 3 times a week, which is what some of these chiropractors did, and you're there for life. Th- and then they're pushing their remedies and their sales onto you. And I became very wary when I was working at Primary Children's, and one of the chiropractors who I do not see any longer had, pamphlets on the seats, anti-vaccine. Now, I had taken care of children primary children who nearly died and were now brain damaged and had, encephalitis from chickenpox, were struggling to stay alive and to breathe because of pertussis, um, H flu meningitis, all of the things that we have immunizations for. And there could be an argument for the timing of those, but we have measles immunizations. We have immunizations that, yes, every parent has to make their own choice, but there is real risk of harm, including death, when you choose not to immunize and we don't have that herd immunity. And so I, being the outspoken person that I was and having, working at Primary Children's at the time, pulled one of those off and I said, "Doctor, this is wrong for you to be promoting this anti-vax information that wasn't based in science and wasn't based in truth." And he's kept them there. I kept going for a time until I got another referral. But those kinds of things I found really interesting, that my doctors were referring me to other modalities that could augment what they're doing when they were stumped. And
Mhm.
yet my alternative therapists were bashing Western medical. And that has held true with everyone save a couple that I've gone to. And those couple have degrees in the sciences and they're supportive of both.
Yeah.
But most of the time, in my experience, and I've done all of it, I've done acupuncture, acupressure, and my neurologist sent me to an acupuncturist. My physiatrist sent me to the Nuka doctor. My um, oh gosh, I can't, physical therapists sent me to other modalities. Um, my cousin did send me to my cranial sacral massage therapist.
Waiting for this. Oh, come on, Wendy.
So cranial sacral was key to quieting my brain, but it took an awful lot of work, and it was in conjunction with my medical team, and they were all my physiatrist had his cranial sacral certification through Upledger,
Yeah.
and he did unwinding and stuff on me. He's amazing. He was not a DO, he's an MD, and he's not like he's not selling products in his office that make you kind of go, where are they trying to get their money from? Unlike the doctor that my husband saw, hoping to get some benefit for his MS, who sold us Juice Plus from his wife's network marketing scheme and said it would cure MS. It
Mhm.
doesn't. It wasn't
Mhm.
going to, but we were hopeful. And also shot him up with testosterone till his levels were like 10 times normal and said, oh, it's okay. It'll give you more energy. It was dangerous.
Yeah.
So I think, I come at this from another perspective. Being a nurse, being somebody who has embraced and still embraces
Right.
alternative modalities, I make sure to do the research on legitimate websites who will give you the data on both and also the side effects of both. When this holistic doctor, yes, MD, that I went to prescribed me with licorice root, not the DGL, the more dangerous kind, because she had me put my hand on um, some energetic tool that could tell me what I'm missing. As a doctor, it wasn't lab tests, it wasn't those kinds
Yeah.
of things. It was some sort of tool, and she charged, hundreds of dollars for it, and I willingly paid.
Yeah.
And she was very well to do, selling a whole bunch of stuff in her clinic, which is where she got the bulk of her money. Um, and I took the licorice root, and when I had those palpitations and I had the wherewithal to actually look it up. I hadn't looked it up before. And I often don't look things up because your mind is really good at creating a side effect, whatever it's to.
Right.
And so I don't want the side effect. I have found that it's better for me to start with a small dose, because I know my body, and then work up, and if I have a side effect, then I'll look it up. Often, usually. Um, and anyway, so I looked it up, and I'm having these palpitations and my blood pressure is elevated, and it can cause the heart arrhythmias, and it can be deadly. And I learned that day that this is what I am certain caused my mom's cardiac arrest, which
Yeah.
ultimately led to her suicide. And I called the doctor and I said, I'm really worried. I think I need to check my potassium. She wouldn't order a potassium test. And she said, well, just go down on the licorice root. And I said, no, you don't understand. I'm never taking it again. And I didn't. And I haven't. I have taken DGL because it's actually really good, and an ENT was supportive of this. And it's really good for reflux. Once you get on top of the initial reflux symptoms, and you combine it with diet and all of the things that we know helped reflux. But I had laryngeal pharyngeal reflux that sent me to the ER on a handful of occasions where I couldn't breathe at all. In fact, had the had EMS called. My husband called 911. And I didn't stay on the medications for life. And at the permission and approval, more importantly, the approval of my ENT, was able to wean off the the reflux meds. and switch to DGL licorice for, again, a time until I was healed. And, but I had to have that medication first. It was life-saving. So anyway, that's my story, and I'm sticking to it. But I think that too often we want to throw the baby out with the bathwater. And this is what we talked about at lunch. Like, you can't. There's so much bashing of doctors. Having watched my son go to medical school, doctors aren't about hurting people. They're about saving lives. They're
Yeah.
about helping people, just like nurses are. But nurses have an opportunity to be strong advocates, and doctors have an opportunity to listen to patients. And when my sister was diagnosed with cancer and died within 7 weeks, and we were all trying to save her life, we she wanted to do it all. She wanted to try alternative. She wanted to do what the oncologist said. And we were fortunate enough to get her right into an oncologist, get her started on treatment. And she got right into, I think he's a chiropractor too, who sold a lot of stuff in his office. And she got right into him on the same day as the oncologist. And he wanted to do some things that sounded really dangerous. The daily coffee enemas. I don't think we're going to cure her stage 4 metastatic melanoma that was already in her brain, all of her bones, throughout her liver, throughout her lungs, too numerous to count nodules in her lungs and her skin. She was exploding from the inside out, multiple organs. And that daily coffee enema was not going to cure her cancer. And it was going to introduce bacteria. It was going to perhaps cause a perforation and a hemorrhage. You're much more prone to bleeding, on cancer treatments, but also just because of the cancer and to clotting. And the bouncing on the mini trampoline was not going to cure her cancer. It might move some lymph around because you're moving, but it wasn't going to cure her cancer. And it was a risk of a fracture. She had bone metastasis in her legs and her back and her arm. And, she was not going to be fixed there wasn't any amount of juicing or teas or any of that. But for her, it was important to try it all. And I was really fortunate to be able to encourage her to pass everything through her oncologist. If it wasn't going to hurt her, I was okay with that. But if it was, I strongly advocated that she not do a treatment, so much that I would tell the alternative practitioners, that doesn't sound safe. No. And I think that, I learned a lot from that. That it's okay. The patient really is the one in charge of their end of life journey. And she needed to have the meditation that she would do every day. It wasn't going to cure her cancer. She didn't know that. Neither was ozone therapy, neither was hyperbaric therapy, and neither were the saunas. Now, the sauna could have been really dangerous for her because, and she did it, she tried it, but it made her feel lousy, and she only did it once. But her heart rate was already beaten at 100, 110. And then to heat her up, it almost made her have a panic attack. And she was on, 5 liters of oxygen and then 10 and then 15. But so that wasn't a real safe modality either for her at that end of life. But the mushroom tea wasn't going to hurt her. And those things weren't going to hurt. The injecting her PICC line with hydrogen peroxide could have killed her right then. Thank heavens they did not. And then when nobody wanted to tell her she was dying, I had a beautiful chance to let her know there was nothing else to be done, even though another part of the family was willing and wanting to take her to Idaho. She wouldn't have lived to Idaho. She was on too much oxygen, and she died a week after she was discharged. But they wanted to kidnap her and take her up to Idaho, where there was some practitioner who could cure her stage 4 cancer when she had already started into organ failure, and that wasn't going to work. It wasn't going to happen. But she got to know she tried everything. And she got to be true to her heart and true to her desire to live. And then when we had that private conversation that she wasn't going to live, when nobody else in the family was willing to have that conversation, I felt so privileged to have angels surrounding us as we together had that conversation. And she looked at me with her eyes. How am I going to tell my kids? Is there nothing more to be done? And there wasn't. And sometimes we can't heal ourselves. And that puts an awful lot of pressure on us to heal ourselves with this or that or the other. Sometimes it just is. And we live with chronic illness that can be improved by certain lifestyle changes, by certain modalities. Massage and cranial sacral are still important. I have a cranial sacral appointment this afternoon so that my trigeminal neuralgia doesn't overtake my entire life and I can have a few more days of relative relief. But sometimes it's just time, as in my knee. I tried some different modalities and that made it worse. I had a knee injury at the beginning of the year, and slowly and surely it is improving a little bit. I don't know that it'll ever be the same. But I'm grateful to walk around the block now. And I guess my message is, don't throw out the baby with the bathwater. These doctors care about their patients every bit as much as the alternative practitioner cares about theirs. And be wary if somebody wants hundreds and thousands of dollars. You know, I remember when my sister asked the oncologist, and I trust this uncle, he's who I will call if I ever get cancer, because I saw his care for my sister. And he was honest with me when I said, "Doctor, have you ever seen miracles at this stage of cancer? Because if so, then we'll go a little longer." And he said, "Yes, rarely, but she needs to go on hospice. I don't see it happening here. We're already in organ failure." And I trust that doctor. And when she asked him, "Well, what about doing this in Mexico or this?" he was truthful and said, "You can do that. But if your funds are limited, I wouldn't recommend it because it will not cure your cancer." And I trusted him. The only hope she had, and it was a slim hope, were the newer immunotherapies that she tried. In the end, it didn't save her either. For 1 week, though, she stopped having the nodules pop out. But it wasn't enough. It was too late. And in the end, once she knew this was all, she was able to then call people to her bedside, choose the people she wanted to spend her last moments with, and die with hearing our mom's voice, who she didn't know because our mom died when she was 1 year old. And she didn't know her until that moment. And she was able to communicate with her kids because she got to choose how much pain medicine she wanted. She got to choose, do you want the Ativan now? No, I don't. Do you want the Haldol? No, I don't. The next day, yes, I do. Please give me the Ativan. Please give me more Dilaudid. But she got to choose, and that's important for all of us. But don't throw the baby out with the bathwater, and embrace your doctors and get them on board with you. And as nurses, we have that opportunity also to do that. To kind of quietly suggest, well, there might be some decrease in anxiety if we do some music therapy. And there is an embracing of some of these complementary modalities. There really is, in my experience. Now, maybe I have a different experience than many people, but I am willing to question I'm willing to open up the books, the internet, Mayo Clinic, Cleveland Clinic, Harvard, and look for studies. And if it says comfrey can cause liver failure, I believe it. And I'm not going to just do comfrey because my knee hurts. And, and that's what my mother would have done. That's what she did for our dog, comfrey tea when he broke his hip. I wouldn't do that. Even though others suggested that I did. Anyway, that's my story, and I hope it's helpful to somebody. But I think that we're in charge of our own journeys, um, for sure. But I've seen patients die because they chose to do green drinks for breast cancer that's treatable with Western medicine.
Mhm.
And can that green drink provide comfort, even if it's just mental health comfort? Sure. But you do need calories. So find some way to boost those calories because that cancer is going to eat those calories. And she didn't need to die with a huge tumor dripping and oozing out of her body because she so distrusted Western medicine. There's a reason that Eastern doctors from China come to the United States because they don't have it all either. And
Yeah.
in fact, when of um, you look of the studies of cancer outcomes, right? Whether and they're all different. So you're looking at metadata and stuff as you look at these studies, um, because I don't know how ethical it would be to just have somebody only do Eastern medicine for a certain kind of cancer. And then somebody, you can't really do that kind of a group. So they're observational studies. But when you look at the metadata, the people who do Eastern only fare the very worst, then Western. And the very best is a combination Western with
Yeah.
some of that Eastern. That's the
Yeah.
very best outcomes. And part of that is because your brain's getting right, you're focusing, all of that. But you know, just question it all and then take it to God, your higher power, yourself, your inner soul, what feels right for us. We had to do that when Mark is puking his guts out. My husband is puking his guts out after chemotherapy. Oh my gosh, is this really what we should do?
Yeah.
And it was a 2-year course and having to go in, for because his white cells are so low. And we had to know in our hearts that this was right and this was important. And and it was. And in the end, it proved to be. So
Yeah.
that's my bit of advice. Any
Yeah.
questions? Anything?
I mean, we could talk for hours about a lot of things, but I think today is about holding space for your story and what you've experienced. And again, like whether people agree or disagree, um, the point is this is a different perspective of, I think we're hearing a lot more of the distrust for Western medicine right now. Those seem to be the more loud voices. And there are plenty of reasons to feel that way. And, if we break it down, but we also have to swing the pendulum and show that there's another side to that where there's a lot of people who have been, uh, you know, taken advantage of or mistreated or given false promises by these modalities or people. Like, I think there can be grifts on both sides. And so our job is to get educated and to find the balance and to, like you said, not throw the baby out with the bathwater. And that's kind of where I've been trying to hold this space with holistic nursing is, yeah, how do we blend both worlds? I think this is the question I've been asking a lot to my guests is how do we regain trust? How do we rebuild trust? Because there is significant things that we can point out, even though like you have a great son who's got all the the heart of a true physician. And I feel that you and I are, we have the true heart of a nurse, but we also have to acknowledge we work within a system that does make money off of health and health care. And we're seeing a lot of these insurance stories that are denying people proper care and et cetera, et cetera. And the opioid crisis, the trouble that that caused, and the heartache that caused. So while there's both ends have a story, my search in my journey is like, how do we keep what's true without being extreme and just it's all for naught and this is all wrong, and to your point, at the expense of other people and their well-being and their health, and um not living with scar tissue in your tonsils and throat area, and or right now vitamin K in babies is being denied by a lot of moms and dads because they don't need it, but then you just need one baby to stroke out and that be enough, so what I think we all have to kind of do this internal search. I think we've identified the problem. I think we've the long overdue conversation is what is the search within all of us that needs to take place in order to move forward in a better way. I think, you know, in relationships and in life, once we identify the problem, how do we move forward? And that's kind of where I'm holding space for is how do we move forward and hold space for what's true without villainizing everything and everyone and anything in the system. Yesterday I was talking, well, yeah, yesterday I had another conversation with a nurse. We were just trying to find this balance between, educating ourselves beyond our skill set so that we can be an option giver. So I love that you brought to the table that your physician did give you these referrals to other types of practitioners because I've had a little bit more of the opposite experience where I'm like, why don't they give me those referrals? Why aren't we referring to the cranial sacral therapist, the acupuncturist, the foot zoner? When we meet that line in the sand that says, I don't know what else to offer you, but here's some options outside, and some people feel so. I've heard other physicians say, well, I just fundamentally can't agree with that. And I'm like, well, maybe they need to do some research too. I was just I'm researching a course I'm putting up for a Reiki for Nurses course that we're going to be doing soon. And there is research being done on how Reiki can impact patient care and that it's no longer this pseudoscience, that there's actually documented outcomes that it improves the outcome of a condition or a procedure, um, in the sense that it decreases anxiety, decreases pain. Um, so I leave some room for nuance that, you know, someone just came out with all this data on women's health and how we should eat, exercise, and be because she said nobody else was studying women's. We were all treating women like the men who had been studied. And she's like, there was no research on women and how their bodies worked in response to intermittent fasting, exercising, metabolic processes, how we should weight train, et cetera, et cetera. And it's like, well, I didn't when I first experienced like Reiki or these kinds of different types of modalities, there wasn't this evidence-based information, but there was something I knew had changed me by experiencing it. But I was still looking for, okay, well, how do we blend the worlds? I wasn't like, oh, everything is crap because this works and the other things didn't. But then I was like, I'm super excited now that where we didn't have the research is being done. that's where I'd like to move into is like, well, let's research these things. Let's get some data behind, and let's do some FDA approval for nutritional supplements. Let's put these things through some guided programs so that we can do it safely and monitored, and we're not getting taken by these grifters who, like you said, to your point, if you see an MLM run, um, within this thing you're using, like even within my cranial sacral business, I've never been a product person, even though could that be a nice little source of income? Yeah, but it goes against my values, product person while somebody's here. Um, but even cranial sacral therapy has a very strong foundation in physiology and how the body works and how the fascia works, and it gets really complex into um, pathophysiology. It gets really complex into anatomy. And when I did my certification process, I mean, it was brutal. And my instructor was like, "Yeah, this is like a master's level type of pass off. Like, this isn't, you need to be able to explain to a doctor why you're doing what you're doing and how you're doing it." Um, and so I appreciate that they take that so seriously to give it validity. And so anyway, I think because you are, you know, being your friend and having known you intimately, one thing I know for sure, you will research the crap out of it. You
With reputable sources. That's
with
the
real
thing,
there you go.
because the way the algorithms are, if you're just getting stuff on YouTube or
Yeah, yeah.
Instagram or
Right.
no, go to the source, like
Yeah.
go to the sites. And these things are being studied. If you look on NIH, you're going to see a compilation of a lot of the studies. Um, the
And
NIH
by people
website.
who care, and by people who want
Right. Right.
want you to have a positive outcome with your health. Like
Right.
people who do like it's not all is there corruptness? Absolutely. But it's not like you said, we don't have to throw it all out because some people got it wrong or some people had ulterior motives. Um, we have to have some evidence that this has a history of working. It's like even like the GLP-1 medications that are such a hit with the world right now, part of why they were moved forwards in the way they have is because they've been in progress for so long, and they do actually have research and data behind them in their effectiveness, and
Yeah.
they've been used for a long time. It's not, some random medication that was just thrown out there. There is research behind those medications. So that's just an example. But yeah, like I was on the PubMed site for the Reiki research. But yeah, there's lots of reputable places. I agree. Don't just there's a lot of grifters on social media. Like more and more you see that it's about acting and it's about what's entertaining and what catches your eye and what's rage bait and all that. Like that's not true research, and that's not where we should be getting our information. We should be questioning everything when we're
Yeah.
looking at that
Yeah.
information.
And that, goes to question your doctor. Like yesterday I had a doctor appointment just cuz my I had my wellness exam, which honestly are kind of a joke because they don't touch you. This is a Medicare requirement, and you could do it by checklist. It's dumb. They don't listen, etc. So
Yeah.
they called and said, the doctor's not, doing wellness exams any longer. A nurse practitioner who I've never seen will do that for you. Well, I can't, I'm like, well, they're dumb. I don't want to see somebody that I've never seen before. And I still want to keep my doctor appointment because I got questions.
Yeah.
Like, why am I not healing? Here's all these labs. And I had done some research and I came with a list of symptoms and labs and let's just make sure. And you know what? He's a family medicine doctor. I had recruited him as a medical director when I was the director of home care. And he's been my doctor ever since. And he was magna cum laude and he's basic to the research, etc. And he was willing to do those labs and also to recommend something that I'm a little worried about, to recommend we look at my hormones. And I- I've not ever taken hormones. I'm, you know, I have, and I've gotten headaches from estrogen, but I'm willing to take another look, after doing some research, and I'm going to take another look. And, he's like, transdermal has less side effects and blah, blah, blah. Anyway, I think he might have gone to Harvard. I don't remember where he went to, but he's brilliant. And I just think it takes being your own advocate or somebody else with you. It's always important. My sister was overlooked. Her symptoms were overlooked. She always went to the doctor alone. Now they missed not only her metastatic melanoma when she had liver pain for a full year, but they missed that same year they missed that she had cervical cancer too. And it was kind of like a oops, you had a positive exam. Anyway, positive biopsy. Well, that was the least of her worries by then, but she never went with anybody. And I think that you're safer if you always have an advocate, whether you're in the hospital, whether you're at a doctor's office, or whether you're at acupuncture. It's important. I had big side effects to acupuncture, and I tried, acupuncture can be very expensive. My insurance pays for acupuncture. There's a lot of good data about pain management, nausea, that kind of stuff. But, and my insurance actually covers acupuncture and chiropractic, but, because there's good data. But, I had a lot of side effects to acupuncture and wished that I had had somebody to drive me home because I was so discombobulated after. And I tried it several times. I had good results when it was very localized, but when it was kind of on all of my limbs, oh, that was bad. And granted, that was after a brain injury, not just for a specific, shoulder injury. But
Yeah.
um, I think it's important to go with somebody to question, to be your strongest advocate. And if you're in the hospital, have somebody else be your advocate, even if it's to wash their hands,
100%.
and to know what you're taking, because you're not going to remember that.
Right.
And same thing in these alternative modalities. It's important to have somebody there because you're desperate. If you're seeking out everything, it's
Yeah.
usually out of desperation and feeling like, Western medicine failed you is not sometimes really what happened. It's just they didn't have the answers. And and um and you're desperate and you'll spend whatever it costs, to a
Yeah.
point if you've got it. And people know that. I tortured myself with some electrical stimulation that was going to cure XYZ at an MD's office, and it was $125 a pop, and it made my pain worse. And she wanted me to keep coming back. And I'm like, be okay to say, that
Yeah.
didn't work. Be
That
okay
wasn't
to do
for
that.
me.
You've got to
Yeah.
be your family's advocate and you have to be your advocate in whatever setting it is. And then you also, research, be your advocate. And then as far as bridging the two, I really think that we're at a point that people are open to conversation. And if they're not, they might not be the doctor for you.
Right.
But my experience has been if I'm willing to open my mouth and share, this didn't work, this did work. And they can pick up on your fear of medicine too. I've learned that. So they're going to try the smallest dose, but I have to remind them I'm really sensitive to meds. So I need the tiniest dose.
Yeah.
When I had this 2-minute memory with amnesia a couple of years ago, I'd give permission. And then by the time, for the Ativan, but I would tell them I need the tiniest dose. I'm really sensitive. And they're like, sure, sure. And by the time they get there, I forgot that I'd given them permission. I'm like, what are you doing? No. In the end, my good doctor's son is the one I remember because after I got the Ativan, that temporal lobe seizure or whatever was going on kind of started subsiding. But so I remember this conversation. That's kind of the start of my memory. I had no memory before that. But um, um, once they gave me the Ativan, it's like, oh, it's heaven. I can get an MRI with Ativan.
Right?
But thankfully, he was my advocate at that time. When I had he was my advocate because I was having a reaction to a local anesthetic and to lidocaine. And he's the one who understood what was going on and could talk to the doctors. And thank heavens, we all need an advocate, and we need to not be afraid to question and to open up a conversation
Yeah.
and to say, what do you think about? And I think most doctors are open if it's not going to cause harm.
Yeah.
Will they prescribe it? Not necessarily. Will they do like my neurologist did, who's straight arrow neurologist, fabulous, but she knew that I hadn't found relief yet. And I eventually found a medication that would help with this trigeminal neuralgia, but it does cause kidney issues. And so I take it minimally. But she knew I had gone through many medications, and she printed off a sheet that said, Wendy, there's some data around magnesium and CoQ10, taking it at night. And there was one other thing, and I tried them, and it didn't take this away, but I tried it, and I trusted her because she had the research to back it up.
Yeah.
But I think it's developing the relationship with patients. If you're a doctor, listening, looking at them more than at your computer. Um, and then as patients, there are things we can do too. If we're grumpy, they're not going to listen to us. Whether we're a grumpy nurse or a grumpy patient, a doctor is super busy. They have productivity standards of 30, sometimes 40 patients a day.
Yeah.
And it's really hard to be a doctor in today's world because the practices they're working for want to make money. The insurance companies want to make money. They deny treatment that is life-saving. And it's a really hard environment for these doctors, and they are burned out,
Yeah.
and they get burned out quickly. And we need to have a little grace and understanding of our doctors too.
Yeah.
And then just be willing to be open. And as a nurse, a nurse, not NP, but a practicing nurse, in a doctor's office or in a hospital setting, being kind in your approach and really opening up the conversation and saying, I've had some success with XYZ. Have you read about it? Do you have time? When would be the best time to do an in-service? The pharmaceuticals bring lunch, and they get an audience with the doctors. We can do the same on the other side, and we can bring lunch. And does it cost some money? It sure does. Or we can, have a brown bag lunch, and have an in-service and share some of these anecdotal stories, but also the data. Doctors are driven by data, and there's good reason for that, because harm can be done when you're not driven by data. Harm can still be done. There are still bad outcomes on whichever side, and we still die, and we still have pain. But the more we can communicate and love and be driven by our hearts, the better. But doctors are tired. They are so tired. I want a neurosurgeon, though, who is committed to his art and to his craft if he's working on my brain to get rid of the aneurysm or the brain tumor and to give me a little life back and a little hope.
Yeah.
So
Yeah.
anyway, I think it all boils down to relationships
For sure.
and grace, give
We all need some grace right now.
everybody grace.
Everybody in the medical field, just give us some grace.
Yeah.
We need
Yeah.
it. Um, it's been a lot. So, well, thank you for sharing your story, your perspective. You like I was saying, if there's something I know about you, you've researched it, you've studied it, and you've internalized it on any topic. We're not just what we're talking about today, but any topic. And when you feel passionate about it, you have to say something, and those are the things I know to be true about you. So, um, I love all those things about you, and I'm grateful that you would be willing to come share your perspective today. And, this is what we get to learn to do is hold space for different perspectives, different opinions, and it doesn't have to blow up the ship and it's going to be okay. Like we're all okay if we don't see the world the same way, but also just leaving that room for nuance and different. And like I said, I think I would say if we went back to all the previous episodes, most of the stories are being let down by the system, the current Western system, and then finding different modalities or, um, medicine or medical practices outside of that. And so it's good that we swing to the other side of the pendulum to let people know that both sides exist. So,
Yeah.
um, I want to have more conversations with you in the future. I think we have lots of things we could cover. Today was just about holding space for you and your story. And so thanks for being here, my friend.
Thanks for inviting me. Love
Yeah,
you, Holly.
love you. Um, Wendy does have a book she wrote, Hope Through Suicide, and it was um, your
Hope
memoir.
after suicide. Yeah,
Hope
hope after
After
suicide. One woman's journey from darkness to light. And it is my healing journey following the suicide death of my mom that I wrote after my bike accident, when I was not able to go back to work. Um, and I think it's an important story. It does share a little bit about my mom's story, mostly about that really difficult space and journey, um, of healing.
Well, and mental health is a huge part of our um, healing, our well-being. It's it's mind, body, emotion, spirit. So when we're talking about, a lot of times we think physical, but the mental is a huge part of what we look at in medicine too. And so you can find that on Amazon. You can find it where Barnes
I
and
don't
Noble.
know if it's still on Barnes& and Noble. I looked yesterday. It's been out since 2014, so it's 12 years
Good.
out.
Good.
There are a handful of copies left. Um, I don't know if they're gonna print anymore, so it's almost out of print, so if you want it, you should go on Amazon.
Okay.
You can also find it at Cedar Fort. They do still sell it there.
Yeah.
But I do know as of yesterday, it's still on Amazon.
Okay. Perfect.
I need to go buy some up though, because I'd
Yeah.
like my children and grandchildren to have a copy, and
You have a copy.
we'll see.
Of course. Um, and then for anyone who wants to learn more about our academy, go to holisticnurseacademy.org. We will leave links and bios in the notes. And until next time, we will see you. Lots of love and healing to everyone, and we hope you have a great week. Thanks, Wendy.
Thank you. Bye bye.
Bye.